Do you need this?
Should be alright. Let me know when you're good.
Go for it.
Alright. My name is Cobern, and I'm here performing the lever test. So with the lever test, we're going to focus on to see if the ACL in the knee is still intact or if it's been damaged. A positive sign would mean that it's been broken or there's something wrong with it. So what we're going to do is we're going to lift the leg up here, place a fist under, and we want to make sure that the heel is in contact with their surface. So this hand's going to act as a fulcrum, and we take our other one, place it on the femur, and we're going to push down. This is not giving us a positive test, meaning that his ACL is fine. If it were damaged, then his heel would not leave the table. So this is a good sign. It's good to do off field. You don't want to do this right on the field because it could take long. Yeah.
Good. Hey, I'm Tyler Woodruff. I'm going to do the anterior Lockman test. So the test is performed by pressing down on the femur with one hand and then getting under there a little bit, pulling up on the shank or the calf. And so the positive test would have been lax, the joint would have moved more, and that's a sign of a torn ACL.
Alright, my name is Timothy Covington, and I'll be performing the Mendini test. So with this test, you're looking for a fracture in any long bone, but for this we're doing the foot. So for this test, you're going to want to grab the length of a long bone, and you're going to want to do some light compression with a little bit of twisting. And if there's pain, then that is a positive test of a fracture. This test would probably not be performed on a field just because you got to get their whole foot out. But yeah.
Alright, I'm Keldon Harris. I'm going to be doing the athlete's compression test today. So simply what we're doing is we're just having him lay on his stomach, and we're going to pull his leg up into a 90-degree angle. And now we're testing the meniscus to see if there's been damage done to it. So simply you just put your hand on it, put a little pressure, and then depending on if you want to test the lateral or medial, is depending on which way you will turn it. So if you turn it and there's no pain, that is a good sign that his meniscus is not hurt. But if there is pain, then it's a pretty high chance, or it's a positive test, which means there's a chance of it being injured still. This test you would not do on the field. This one you would more do like in the training room, just because it takes more time and you don't want them to be laying on their belly out on the